Hey, I'm Elizabeth. I'm just here from the ED bringing you our patient, Tommy Smith. He is a 5-year-old male who's being admitted to your pediatric floor, so I was hoping I could give you a report.
Sure, go ahead.
So I can get out of here because I've been here all night.
Go right ahead.
So Tommy's being admitted for an asthma exacerbation. Tommy is a full code. He is allergic to cats and penicillin. His weight's 20 kilos. He has a history of multiple hospitalizations for asthma exacerbations, unfortunately. But overall, besides the asthma, he's overall healthy. Tommy's mother reports that he started having some cold symptoms a few days ago and that he's been needing his albuterol inhaler for shortness of breath frequently at home, but it stopped helping him as much yesterday. So sounds like overnight she noticed him working harder and harder to breathe and ultimately brought him in at 4 a.m. this morning.
Okay.
He also was at his grandparents', I guess, this weekend, and they have a lot of cats. So unfortunately has had some common triggers that he's been around. So assessment-wise, Tommy's vital signs are a temperature of 101.1 Fahrenheit. His heart rate is 120 last I checked. Blood pressure 110/50. His respiratory rate is 48. And his oxygen saturation was 90%. Neuro-wise, he is oriented ×4. He's very interactive, just a little bit tired from being kept up by us, essentially, giving him breathing treatments tonight. His pupils are pearl. He's moving everything, no concerns there. From a cardiovascular standpoint, his rate and rhythm are regular, no murmur noted. However, as I mentioned, he is a little bit tachycardic. Overall warm, well perfused. He has +2 pulses throughout, but slightly delayed cap refill of 3 seconds. I have notified the provider that he remains tachycardic and has that delayed cap refill, and I'll get to that a little bit at the end. But because of that, we left him on continuous cardiorespiratory monitoring, so we can keep a close eye on that. Respiratory wise, he's on 2 liters nasal cannula. We increased that from 1 liter this morning at 6 a.m., so just a little bit ago. He does have intercostal and subcostal retractions, but they have definitely improved every time he gets albuterol. And he has been getting that about every 2 hours since coming in, and then we are adding in Atrovent nebs as well, twice daily.
Okay.
His respiratory rate, just depending on when you catch him around the timing of giving albuterol, has been anywhere from 30s to 40s. So I think he's definitely showing that he's ready for one coming up here shortly.
Right.
Since he's a little bit higher. He has inspiratory and expiratory wheezes throughout. Those are changing as well, depending on timing of albuterol. And oxygen saturations were 85% before we put him on oxygen, and then have definitely improved since the 1 liter, but still in the low 90s.
Sure.
On the 2. We also added and started IV methylprednisolone Q6 and singular once daily. GIGU, his belly's soft and flat. He has active bowel sounds, no concerns there. He just hasn't voided since he got to the ED at 4 a.m.
Okay.
Skin wise, we placed a 22 gauge right AC PIV. Right now we're running D5 half normal saline at 60 mLs an hour. No other skin issues I noted. Pain, he has denied pain, so that's good. So overall, our plan of care and my recommendations, we are going to continue to monitor his respiratory status closely. Since his work of breathing has improved with albuterol nebs and the Atrovent, along with adding in oxygen, we're going to just plan to give the steroid a little bit more time to work, and we'll continue to provide education to mom about maybe some ways to troubleshoot avoiding triggers for him.
Sure.
We also are planning to put in a allergy referral as well. And then the only thing I'm just waiting to kind of clarify with the provider is if they wanted to do anything for his oxygen sats, just because they're still in the low 90s on these 2 liters. So waiting to hear back about that. And then I did, sorry, there's a couple things I left for you, but they just put in for a normal saline bolus.
Okay. Sounds good.
And then he's due for his albuterol in 30 minutes.
Oh, that's fine.